Bacteria of chronic urethritis. The occurrence of mixed infection in chronic urethritis is due usually to the bacteria harbored by the normal urethra, rarely to contamination by instruments. Moreover, the bacterial findings are not quite the same in chronic anterior urethritis and in chronic prostatitis. Hence, we must consider the bacteria of the healthy anterior urethra, the bacteria of chronic anterior urethritis, and the bacteria of chronic prostatitis. Bacteria found in the healthy anterior urethra. Pfeiffer examined 24 urethrae and found diphtheroid bacilli in 21, streptobacillus in 10, and Staphylococcus pyogenes aureus in 5, Miscrococcus candicans in 4, Sarcina alba in 14. Petit and Wasserman found 5 kinds of cocci, 6 kinds of bacilli. Franz in 56 urethrae found the Sarcina once, the Bacillus coli once, pyogenic staphylococci 6 times, streptococci twice, and 7 other varieties of cocci and 4 varieties of diplococci. These bacteria are usually found at or near the meatus. The deeper portion of the anterior urethra is often sterile. Bacteria of chronic anterior urethritis. Of 154 cases examined, 20 were sterile, 10 showed gonococci alone, 10 gonococci mixed with other bacteria, 114 other bacteria without gonococci. Of von Hoffmann's cases, the gonococcus apart, 18 showed pseudodiphtheria bacillus, 12 streptobacillus urethrae, 2 bacillus subtilis, 3 Sarcina alba, 1 Proteus vulgaris, 1 Bacillus coli, 1 Friedlander's bacillus. He also found 27 kinds of staphylococci, 3 other cocci, and 6 kinds of bacilli. Bacteria of chronic prostatitis. Young, Garrity, and Stevens examined 19 cases, 2 non-gonorrheal, and obtained a growth on agar in only 8. The Staphylococcus albus was identified thrice, the Streptococcus pyogenes twice. The anterior urethra was copiously irrigated, and the prostatic secretion obtained through a sterile urethroskopic tube. Control cultures were made from the bulbous urethra. Nothaft, using less careful methods, examined 120 cases. He found the gonococcus alone in 5 cases, all within 18 months of the time of infection. The gonococcus alone or with other bacteria in 60% cases of less than 18 months duration, in 18% cases of from 18 to 24 months duration, in 6% cases of from 24 to 36 months duration. The gonococcus was not found after the 3rd year. The gonococcus was found 47 times, other micrococci 119 times, bacilli were found 15 times, other bacteria 14 times. Cohn, in 12 cases, found Staphylococcus albus 11 times, Streptococcus 3 times, Bacillus coli once, other bacteria thrice, no gonococcus. Bacteria of chronic vesiculitis. Gonococci are very rarely found in the chronically inflamed vesicle. Cultures are often sterile. The flora includes Staphylococcus, Streptococcus, Bacillus aerogenes, and Bacillus coli. Summary. Thus, the gonococci that swarm in the discharges of acute gonorrhea are by no means always present in chronic gonorrheal urethritis and prostatitis. Nothaft quotes in favor of his thesis that they disappear from the prostate always within 3 years, often within 18 months. The names of Neisser, Finger, Frank, Wasidlo, Jadison, Goldberger, and others. The thesis may, I believe, be extended to include all the urethral glands. I have seen but one apparently authentic case in which gonococci persisted for 3 years in the urethral secretion, not more than 3 or 4 in which, in spite of vigorous treatment, they persisted for over 2 years. Earnest investigation during the past 3 years, with the aid of the complement deviation test, has served only to confirm this belief. The rule is almost without exception that a chronic gonococcic urethritis ceases to show gonococci in its secretion within 3 to 6 months of the beginning of intelligent local treatment.